Hello and welcome to Keep Talking, a community dialogue about mental health. Hello, my name's Gay Maxwell and I am the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is a 185-year-old addictions and mental health treatment hospital in southern Vermont. We serve adults, teenagers, and children in a variety of outpatient, inpatient, and partial hospitalization programs. The Brattleboro Retreat provides care and courage when being human hurts. Today, I am very lucky to have a woman by the name of Dr. Leslie Korn, visiting all the way from Mexico. She has just spent the day presenting a conference called Culinary Medicine and Nutritional Therapies for Mental Health. She has presented this to a group of mental health professionals from all over New England, and she has been willing at the end of a very long day to come and speak on Keep Talking with me about what she does and what people might want to know about nutrition and mental health. Welcome, and thank you so much for spending your time with us, Leslie.
My pleasure, Gay. Thank you.
You are a licensed mental health counselor. You have an MA in cross-cultural health psychology, a master's in public health, in international health. You have a PhD in behavioral medicine. You have a really broad number of, a broad expertise in many areas, it seems. And on your website, you identify yourself as a traumatologist, and a professional who practices nutritional and integrative medicine for optimal mental health. Can you tell me a little bit about what traumatology is? Now, when I looked it up in Wikipedia, it said the study of wounds and injuries caused by accidents or violence to a person and the surgical therapy and repair of damage. But I don't think that's exactly what you do, from what I understood today at the conference. So tell me what is different about what you do. Please explain what you mean by traumatologist.
I think the first part of that definition would be correct. I don't, however, conduct surgical repair, perhaps repair of the mind and body and even spirit. Clinical traumatology suggests that when we experience overwhelming experiences, adverse childhood experiences, abuse of any kind, but also accidents, natural disasters, we're going to feel overwhelmed, and our experience is going to often cause us to shut down and go inward or become hyperreactive, the proverbial jumping when we hear a pin drop. And over the years of work as a psychotherapist, I discovered that it didn't involve just the mind, it didn't involve just emotional feelings, but it also involved the physical manifestation of trauma. And I developed a practice that works with treating both mind and body, and ultimately where people are interested in it, trauma also affects the spirit. It affects the sense of hope, the sense of purpose, the sense of meaning in the world, particularly if we suffer at the hands of another. And so that's a little bit about what we do in traumatology.
You also have used the term integrative medicine. Can you give me a description of what exactly that means and what's not integrative about going to the doctor to get your checkup, say?
Well, sure. I think a lot of us came to this work, we came either from the study of conventional approaches. I certainly studied conventional public health. I studied conventional psychotherapy. I trained in conventional settings. But I also had many years of study in the jungle of Mexico with indigenous practitioners, studying what's really called traditional medicine. Sometimes we use that term to mean conventional, but it really means the traditions of culture. And I studied that for many years, practiced it in the jungle, and at the same time studied what we now call complementary alternative medicine. medicine. We're then faced with, how do I bring it all together? How does the conventional, the mainstream, work with some of these other approaches that may be outside the standard scope of intervention, but nonetheless have tremendous value and empirical evidence? And so those of us who practice integrative medicine are really integrating both the conventional approaches and what we think of as alternative or complementary, and in my case also traditional indigenous methods.
How long would you say that the term integrative medicine has been around? Is it new? Is it old?
I think the practice is quite old, but the term is quite new, like many things. I think our studies of complementary and alternative medicine, if we really look at them, really come from indigenous medicines that we've secularized. We've taken the spirituality and the religion out of many of our practices. Take Chinese medicine or any kind of hands-on work, and we've kind of, to make it more acceptable, think about mindfulness. Comes out of Buddhist traditions of meditation. But in psychotherapy, those of us in the psychological field have worked to, not me personally, but have secularized it so that it's more palatable across all peoples, and so religion and spirituality doesn't even get in the way. So the practices have been around forever, this idea of integrating, learning from other people, but more recently the term integrative medicine for mental health is relatively new, and we see many physicians, nurse practitioners, PhDs taking what we've learned from other methods and integrating it into the conventional, and sometimes even decreasing the amount of the conventional intervention and emphasizing the complementary or alternative.
Mm-hmm. And how does the traumatology and the integrative medicine go hand in hand for you?
Well, thank you for asking. I'll give you an example. My original training in the jungle was as a body worker. I studied with local curanderas. I studied massage and herbal medicine, traditional approaches to herbs and foods, for example. But my main work was studying is in energy healing and in what we call cranial sacral therapy, polarity therapy. It's a form of body work based in Ayurvedic Indian medicine. And it was many years practicing this, and as I held people's heads or their pained arms or lower backs, whatever the treatment was, people began telling me the stories of their lives, the stories of their trauma. I remember one woman, an early patient of mine, was a 65-year-old woman from Brazil. And she had been raised in a convent, and she came to me just in tears over a spasm in her neck and shoulder. And as I touched the spasm, she began sobbing and recalling for the first time a memory of having been in the convent school. And because she wasn't sitting up straight, the nuns took a broomstick and stuck it behind her arms through her elbows and made her sit up straight in the corner for 3 hours without moving. Now at 65 years old, she'd forgotten this experience as a 13-year-old, but as I touched the area of pain and said, "Tell me, what is there? What is the story?" this memory emerged, and we began integrating touch, the healing touch, along with the psychotherapeutic process of exploring that memory and reconstructing the meaning of that experience. Those experiences took me to the formal study of conventional psychotherapy, and that's an example of integrating body work with psychotherapy, which is a whole new area of work called body-oriented psychotherapy. Now, conventionally, psychotherapists are not trained to touch, and there's a taboo on touch, as well there should be. I don't think that unless you're trained, any more than if you're not trained with a scalpel, should you conduct surgery. But there's a whole new arena of people who are integrating both touching the body therapeutically with a particular intervention, along with telling the story. There's an old saying, the body tells the story the mind can't find words to express.
Mm-hmm. So what came first for you? Working with people with experiential trauma or mental disorders, or was nutritional medicine your first passion? It sounds a little bit like it was working with people.
It was very
touch.
It was very integrated. Living in the jungle, I was very lucky to arrive and live where there were no cars, no roads, no electricity, and no doctor. And I proceeded to get sick with absolutely everything there was to get sick with. But that was such good fortune because I had to rely on myself, rely on what I knew and understood in terms of breathing and meditation and yoga. I learned from the local women about herbs and the traditions of rubbing a ground sea urchin on the skull to relieve pain.
Oh my goodness.
So I spent many, many years as an apprentice learning. And as I then practiced, the stories people told me as I touched, as I helped them heal, then took me to the study of psychology. Now, intertwined with this was nutritional therapy, understanding nutrition, and then from there, I'll give you an example about the integration of traditional indigenous methods with conventional training. One of the first things I learned in Mexico is I noticed that every Sunday the men would slaughter a cow and lay the beef on a large table, and a few men would climb a papaya tree and they would take down several green papaya, score it, slice the skin, and out would come this white, sticky, oozy substance, and they lay the skin all over the beef. Well, little did I know that is a proteolytic enzyme, means protein digesting. By the way, it's the main ingredient in Adolf's meat tenderizer. So when I went back to study public health, I focused on the science of indigenous science, of indigenous wisdom. And certainly we understand proteolytic enzymes not only serve as meat tenderizers, but they aid our digestion of protein, so that if you're having a hard time digesting protein, you might take a few pills of papain and bromelain. Bromelain is from the pineapple. And then from there studied that taking these enzymes on an empty stomach digests the protein of inflammation. And we know that inflammation underlies depression. Depression is not a dis-ease of not enough serotonin, it's a disease of inflammation. So the route, albeit circuitous, from papayas to the School of Public Health to understanding inflammatory process in the body and depression has been a very smooth one.
Well, so it sounds like what makes you different than, let's say, a dietitian is this whole piece of integrating the traumatology, the psychology, and also this indigenous culture or cultures that that makes you very different than just a regular dietitian. I'm not that I'm putting down dietitians. I'm just saying you come from a different place.
Yes, I think our training and background is a little bit different. It certainly can be complementary, and I collaborate with many disciplines. I think the key finding that I discovered, and I'm not alone in this, I think we have many great scientists who've come before me who've identified the principle that there's no one right diet for anyone or everyone. And we look at the role of culture as a determining factor in diet. For example, in my role at the Center for World Indigenous Studies, which is a Native organization, we work with a lot of Native individuals up in the Pacific Northwest, up in British Columbia, up into Alaska. What is the diet of these individuals? It's very rich in fat, moderate amount of protein, and very little carbohydrates. Remember, before contact with Europe, the Western Hemisphere had no pigs, no cows, no wheat, no milk. And so the principle behind my work in nutrition and mental health and trauma suggests there are people who thrive and do well with lots of fat, moderate amount of meat or protein, not too many carbs. And then also, that's not right for everyone either. There are people from India, from Africa, from Mexico or South America who may do very well on a predominantly Mediterranean or vegetarian diet. What that says to us in our age of fad diets is that there's no one right diet for everyone, and treatment must be individualized. And that links to our work as we personalize the recovery from trauma and not only the care and the talking that we do that's individualized, but understanding the individual needs for certain nutrients or certain kinds of foods as they recover.
So do you actually employ diet, supplements, both? How do you work?
Yes, I use foods, whole foods. We have a saying that people are suffering from the SAD diet, the standard American diet. And so I think there's something that we all benefit from, which is eliminating some of the inflammatory foods like refined sugar, refined flour. It doesn't matter where you're from in the world. You'll benefit from not having Coca-Cola. We know that aspartame, Diet Cokes and Diet Pepsis are very, very bad for the brain, particularly trigger people with bipolar disorder. We know that if children aren't getting enough essential fatty acids the first year of life, they're very vulnerable to learning disorders. And then maybe we say they're not paying attention at the age of 10, and instead of giving them something besides Cheerios and milk, the standard American diet, we might give them eggs, very rich in choline for the brain, perhaps some protein. So we really look at each individual and work with them both culturally, but more so genetically, because our culture in many ways defines our genetics, and our genetics really defines where we've come from. You and I may have we may have family that's come from Europe. We carry that genetic heritage hundreds of years after they've arrived, and that's still going to inform how we digest food and how we fuel our brain, just like we fuel a car with low octane or high octane.
When you do a history with someone who comes to work with you, do you talk about generationally where they came from? Is that an important part of your intake process?
It's very important, not only because it builds rapport, it shows respect, particularly when we work with migrant populations or recent refugee populations. People love to talk about food. They love to talk about what they want to eat, and we know that there's a lot of stigma associated with saying, I'm depressed, I'm anxious. I begin often talking with people about their physical symptoms. People feel less stigma saying, my stomach hurts, I get these headaches, my back hurts. And from there, I gain trust, and it's not too big a leap to talk about how they're feeling about the pain that they're experiencing. And so the stigma is released, and we can talk all about their heritage, their culture, their great-grandmothers' special recipes, and it gives us a good foundation for building self-care strategies.
I was about to ask you, when people seek out your services, what are the identifying problems? Are you saying generally people come in with a backache or a headache or irritable bowel? Is that how things usually start?
Because I specialize in the treatment of trauma, the treatment of most often people who've experienced some kind of abuse in their life. It could be rape or an attack, or could be some kind of overwhelming growing up in an alcoholic family. It could be any number of things. We know that the effects of that experience are not just emotional, but we know that there are very high rates of substance abuse in people who've experienced trauma, chronic pain, very high rates, even things that we don't normally think of. Gastroesophageal reflux, which is acid reflux, autoimmune disease, which is much higher in women than it is in men, fibromyalgia. All of these, gastrointestinal disease, have a link to the experience of trauma. Now, you asked about integrative, and here's the crux of that integrative approach. Oftentimes in our society, we go to mental health people for mental health treatment, and we go for the physical health treatment to a nurse or to a physician. The physician often doesn't understand trauma, nor does she want to get into that Pandora's box, so the research says. Likewise, mental health people aren't trained in the physical, so no one is helping this individual understand, unless they're doing truly integrative work, that their physical problems are rooted in their emotional life, and their emotional distress is reflecting their physical distress as well. So if you're trained in both, you can integrate and you can share with someone, and it's often quite illuminating for someone to say, I didn't know that the stomach aches that I have are linked to my early life stressors. And we can find ways not only psychotherapeutically, but nutritionally to help that individual. And that growing awareness of the connection is not only a function of integrative from the clinical point of view, but the client or patient herself begins to integrate within herself. So there's not a lot of dissociated symptoms going on that makes her take an aspirin for a headache that really is rooted in chronic tension that comes from PTSD.
You mentioned a few things before that are just generally not great for your brain. You mentioned Diet Coke and did you say aspartame? Is that what you said?
Aspartame, yes.
Aspartame. I wonder, for people watching this today, I know that you do very individualized plans, but what are you seeing about the SAD diet that you would most like to change?
I think the approach that benefits all of us is to decrease the negative exposures, like the refined sugars, the refined flours, which cause a lot of pain in the body and depression. So we want to decrease those things that we're exposed to at the same time that we increase the healthy foods. Now, I'm going to share with you a few of those healthy foods that you're going to say, really? Eggs, 2 eggs a day. Do not worry about your cholesterol. It's one of the best foods for the brain, one of the best foods for depression there is. Butter. Did you know that butter is one of the best foods for you, along with olive oil? So you want to get rid of the margarine, get rid of the fake foods. I always look to Mother Nature and say, did Mother Nature make margarine, or did she make butter? Did Mother Nature give us olives, or did she make trans fats? And so we can look to Mother Nature as a guide to saying, we're human animals walking this earth. We need to nourish our engines with the foods of nature. And so using these foods, these healthy fats, our brain, after all, is made up of 60% fat. So we better nourish it with good quality fats. So dump the bad oils, the canola oil, the margarine, the fake stuff, the egg whites. Eat the whole egg, because the whole egg has choline, which is very preventive of cognitive decline and Alzheimer's disease.
So if you could recommend 3 habits that you think every person should adopt that would pave the way towards optimal health, and we haven't really talked about your vision of optimal health, but if you could say 3 things that the average person could do, what would you suggest?
I suggest a concept called food substitutions. You don't need to be an ascetic. You don't need to be a monk or a nun, or you don't need to deprive yourself. If you have a sweet tooth, say, sugar is not good for me. It's causing my pain. It's causing my depression, my joint stiffness, but I like sweets. How about a little raw honey? How about a little real maple syrup? How about a little stevia? So say to yourself, I want something sweet, but let me truly nourish myself with something that's not only physically and emotionally satisfying, but that's going to be healing medicinally. Food is medicine, so use your kitchen as your pharmacy. So you're wanting to substitute some of these negative foods without saying, oh, I can't have that anymore, by saying, find a food substitution. Make your own nut breads instead of having wheat if you're sensitive to gluten. If you find yourself with diarrhea after you eat wheat, you may very well be sensitive. And we know that gluten is a precipitant and risk factor for not only depression, but for psychotic disorder.
Wow.
It is an interesting story about that, how that was initially discovered. During World War II in Great Britain, there was a shortage of bread and thus a shortage of gluten. And so the people who were in the so-called, as they were called at the time, mental asylum, did not get their bread, and 50% of them got better. They had a psychotic disorder diagnosis, but in fact, they were allergic to gluten. So that's the first thing. Find a substitute for sugar that still satisfies your sweet tooth. Find a substitute for the bad oils. Let's call them bad fats. That's what they are. The trans fats, the deep fried fats, the canola, the fake oils, and use the oils, even real cream, all of the foods that Mother Nature gave us. Absolutely. I know that we were talking a little bit about cream. One of the benefits of cream, particularly full-fat cream, is it's very low in lactose. There's almost no lactose. So you get the benefits of this full-fat, nourishing protein, but you've got very, very, mostly fat and not much lactose, not much of the sugar at all.
How much skepticism do you run into from the medical community about your approach? Do you, from other healthcare providers, who might find some of your recipes? For instance, you shared some recipes this morning, which I think I would love to try. One is the Repose mineral broth, and another was an anti-anxiety tonic. And do you run into skepticism, and how do you handle that? What's your answer to that skepticism?
I don't run into much skepticism. Most people who take my courses or come for treatment have already tried everything. I'm their last resort. They're already not getting good results from pharmaceuticals, whether it's for physical or mental health issues. They've adhered to the conventional approach, and they have not been successful. So those are most of the people I work with. And then, of course, we've got a whole revolution. I think it's the revolution in mental health right now. We've got nutritional psychology. We've got psychiatrists. I just came back from presenting at a conference of 700 psychiatrists and psychologists, all who are looking at the role of nutrition and mental health. It makes sense.
It's so exciting.
It's very exciting, and for people who are working on their mental health, what I say is, that's great, that's 50% of it. Now, work on your nutritional well-being. Fuel your engine. Are you driving a Volkswagen, which will run on almost any fuel at all, Or are you running on a Jaguar, and do you need to give a lot of protein and fat to that engine? So that's where we get back to the bio-individuality. Some people are natural carnivores, like the Inuit of the North, and some people are natural vegetarians, like many people in India where vegetarianism began. Knowing what kind of car you're driving, knowing what kind of fuel you need is going to enhance your mental health. It's going to help you sleep better, reduce anxiety, lift your mood.
How do you work with people? How could somebody reach you or talk to you if they wanted to?
People find me through my website at drlesliekorn.com. I've got a number of books out, both written for the lay person. I've written them for my clients. I've also written books for clinicians.
What are the names of those books?
The Good Mood Kitchen, Eat Right, Feel Right, are full of recipes and tips for mental health using foods and herbs and spices. My book, Nutrition Essentials for Mental Health, I wrote for clinicians, particularly mental health clinicians who aren't generally trained in nutrition. So I walk you step by step through how to begin applying nutrition in your mental health practice.
So you do actual, I know that you did this presentation today, but you do more extended trainings for mental health professionals.
I do an 18-hour certification training in integrative medicine and nutrition for mental health.
Wow, that is so exciting. You must feel like you're on this, cutting edge things going on in the world right now.
Yes, it's so wonderful to think back of the kinds of experiences I had in the jungle 45 years ago, and to know that so much of this is coming to fruition. I think people are ready. I think people are dissatisfied with many of the side effects of pharmaceuticals, and what makes them work so strong is also what leads to some of those dangerous side effects. And so I think people are rethinking how we're living, how are we taking care of ourselves, how can we align ourselves with nature and the wisdom of traditions from our various cultures.
I had heard from other practitioners that there is a movement in medicine around the whole issue of de-prescribing. Have you heard about that?
Yes, indeed.
Yes. Yeah.
Both de-prescribing and at the same time the mapping of the genome also allows us to prescribe in a much more pinpointed way. Some people are genetically sensitive to the non-steroidal anti-inflammatories that can lead to neurological problems. There are people we know with what's called the ApoE gene who may be at higher risk for the development of Alzheimer's. That's a genetic risk. So how can we preempt that and plan for that? We know that the folates, for example, if you have a particular mutation on a gene, is really the underlying factor in your chronic depression that pharmaceuticals are not going to help, but folate-rich plants and beans will, along with supplements. So understanding that is the integrative approach where we can integrate food, spices in the kitchen, nutritional supplementation. We can even use hydrotherapy. We can put magnesium in a bath and absorb magnesium to help us sleep better at night.
Wow, I've never heard of that. I want to ask one thing, because it sounds, I was about to ask, what do you enjoy the most about your work? Because it seems you bring a lot of, it just sounds like it really sets you on fire, and I just wonder, what is it that you enjoy the most? Because you obviously do.
I really enjoy when I can work with a client who's been diagnosed with a dis-ease that needs a rediagnosis. I really enjoy when someone has been given a diagnosis of bipolar disorder when in fact they have PTSD and they need to eat more fat and protein. I really enjoy when a vegetarian who's depressed and anxious comes to me when I can say, you know what, I love animals too, and I love the environment also, and I too have a spiritual connection and don't really want to eat animals, but you're a biological animal who needs animal protein. So I think I enjoy putting to rest certain myths and belief systems. There's a saying that asking people to change their diet is like asking them to change their religion. And so I like to debunk ideology. We're all unique individuals, so I love when I can connect. Now, I'll also say I love and enjoy testing my husband's recipes and seeing how to adjust that recipe for a mental health menu.
That's fabulous. Well, I want to thank you so much after such a strenuous day, coming here to the BCTV BCTV studio and sitting down and talking with me. It's a pleasure for me to get to know you a little bit better. And I just thank you for spending your time with us.
I'm very appreciative, Gay. Thank you.
Oh, thank you. And thank you for joining us once again for Keep Talking, a community dialogue about mental health. Before I close, I want to thank the BCTV studio. This community television station is amazing, and they really help this program look the way it looks. So I'm always grateful to them, and I hope you'll join us for another episode of Keep Talking. Thanks.